In this video, we will demonstrate on how to take perfect clinical photographs. We will walk you through the process, allowing any user to get perfect pictures every time. Let's get started. Here we see the camera with our tray, which contains our retractors plus the intraoral mirrors. Either enter the patient's chart number or simply capture a picture of the chart information before taking the patient's photos. Once this is done, we go to F1. Normally, we would start with the full face view, and some general tips would be you taking the photograph should be just about at eye level with the patient. The face mode allows you to hold the camera vertically as indicated by the up mark. It's designed for capturing facial views, half-body, and full-body portraits. In taking the photograph of the full face, it ranges from just beneath the chin to the top of the head. When we're taking the profile shots, at times the hair may droop too far forward, so just ask the patient to gently put the hair back behind their ears so that we get a more in-depth profile shot. The next series would involve taking the normal intraoral photographs. This is a natural smile where we take the anterior shot. When you're doing 8 and 9, try to line them up midline as much as possible, with the occlusal plane as parallel to the horizon again as possible. And then we take the right and left lateral views. The laterals should be just about in the center of our frame, and as perpendicular the camera is to the face of the lateral incisors. This series is now repeated using the retractors being held by your patient. Now the last series, we hit the mirror icon. In this area, I'd recommend that the patient be on the dental chair as far back as possible. You also need an assistant. The assistant will not only hold the mirror, but also use an air water spray to keep any mist from fogging up your view. Now either the photographer can be on the side of the patient, but the patient should be turned towards you to some degree so that you are as parallel as possible. There are times when coming from behind the patient enabled you to perform this task a little bit easier. These are some suggestions in using this camera, and in general, once you become accustomed with the features, it won't take you long to capture a complete set of photographs.